Greetings and thank you for joining us again on another edition of To Your Health here on Facebook Live for GBMC. I'm your host, John Lazarou. You know, it's shocking to me that in the United States there are approximately, 14,000 women that are diagnosed with cervical cancer annually. And unfortunately, from those women, it leads to about 3,000 deaths here in the United States. The big problem is, though, cervical cancer can be cured if it is caught in the early stages. Joining us today is Dr. Kimberly Levinson, our Associate Director of Gynecologic Oncology at GBMC, who's going to talk to us today about cervical health, cervical cancer, the human papillomavirus, as well as the vaccine for the virus, as well as the Pap Smear Test. Dr. Levinson, thank you for joining us today.
Thank you.
We have a lot to get to, so let's start off with the first question.
Absolutely.
Let's give a little anatomy update here.
Sure.
What is the cervix and what is its main function?
Yeah. So the cervix is actually the opening of the uterus. It connects the vagina to the uterus, and its function is really to monitor things to and from the upper genital tract. So it actually has an immune function. It can prevent upper genital tract infections, and it also just allows for the passage of menstrual flow. It actually helps with fertility in terms of the cervical mucus is a certain consistency during the time of ovulation. So it has that role.
Okay. Now, we talked about cervical cancer and catching it in the early stages, but I think one of the big ways, we'll talk about screening, but I think the important thing to remember here is, and correct me if I'm wrong, is that the wellness exam, right?
Yeah.
You have to get in there and get yourself checked out. And how often should women have what we call the well woman exam, and why, and at what age should they start?
Yeah. So this is an interesting question because it's kind of like, well, at what age do you begin having doctor's visits? Well, we start them when we bring our children to the pediatrician. And so to a certain extent, there's not this gap between having your pediatric visit and moving along into what we call a well woman exam. Different physicians are more comfortable, in terms of specific teenage ages. But what's important is to know that you're seeing your physician and that they're covering that anatomy and that area. Now, we know that, the screening and prevention process should begin even as early as the age of 9. So in terms of vaccination, if you're thinking about, what entails a well woman exam and how we can keep up with, preventive screening and preventive injections, then we really want to start that at age 9. In terms of screening itself, and I know we'll get to this later on, recommendations are somewhat based on what the results of prior screening has shown. However, generally, we start Pap smear and HPV testing at the age of 21.
That's great information. Joining us today is Dr. Kimberly Levinson, Associate Director of Gynecologic Oncology at GBMC. I encourage everyone who's watching us on Facebook and our studio audience that if you have any questions, please feel free to raise your hand, and please feel free to submit them in the comment section on our Facebook page. If you're worried about privacy, please feel free to message us on our Facebook page as well. We talked about lifestyle changes. So let's talk about the cervix, and then we're going to get to cervical cancer. What are some of the lifestyle changes that affect the cervix?
Yeah. Well, so in terms of cervical cancer specifically, the lifestyle changes that put women at risk are actually the same lifestyle changes that put women at risk for sexually transmitted diseases. So the human papillomavirus actually is a sexually transmitted disease. And as you can imagine, more sexual partners, early age of first intercourse, those are kinds of things that put women at increased risk. Another thing that puts women at increased risk is immunosuppression. So we know that when women are immunosuppressed by one cause or another, that actually the rates of cervical cancer go up by 4 to 5 times. So that is something that significantly also affects cervical health.
Okay. Quick question. So we're going to talk about cervical cancer now. So let's talk about cervical cancer. What is it, and what are some of the main causes of cervical cancer?
Yeah. So cervical cancer is essentially a cancer that begins in the uterine cervix, or in that opening to the womb. There are 2 types of cervical cancer predominantly. They're called squamous cell cancer and adenocarcinoma, and they come from 2 different cell types that make up the cervix. So on the outside of the cervix, or on the area that's closest to the vaginal vaginal opening is the ectocervix, where the squamous cells are. And then on the lining of the cervix, or the canal of the cervix going up into the uterus, is where the adenocarcinoma can form, or the glandular cells are. So those are the two main types of cervical cancer. And essentially, that's what cervical cancer is. It's a cancer that starts in one of those two areas.
Are there any symptoms of cervical cancer? Yeah. And if so, what are they and how is it diagnosed?
Yeah. So a couple different questions there. So symptoms of cervical cancer, unfortunately, there really tend to not be symptoms. There can be some bleeding. Bleeding after intercourse can be one of the things that can be a presenting symptom. However, realistically, one of the reasons why it's so important to get screening for this type of cancer is because often it's asymptomatic, and the disease can be growing there without us knowing, without any symptoms at all. However, we have the ability to see this area. We have the ability to get microscopic analysis, both of an HPV test and of looking at the actual cells via a Pap smear or a biopsy that can allow us to diagnose a precancer and or an early cancer.
Now, in your answer, you mentioned human papillomavirus or the HPV virus. Before we get to that, I have one more quick question. What are some of the risk factors associated with cervical cancer?
Yeah, so again, we know that HPV is involved in more than really 99% of cervical cancers. This is the etiologic agent of cervical cancer. So that's a really important factor. However, HPV is necessary, but not sufficient in and of itself to cause a cervical cancer. So one of the things is that, yes, the main risk factor is having an HPV virus there, because that is a necessary cause for cervical cancer. However, as I said earlier, other things, because that is a sexually transmitted disease, other things that put you at risk for sexually transmitted diseases also put you at risk for human papillomavirus.
Again, joining us today is Dr. Kimberly Levinson, Associate Director of Gynecologic Oncology at GBMC. Dr. Levinson, one quick question. If somebody wants to get an appointment to come and see you, what's the best way to do that? If they have questions about cervical cancer, HPV, sexually transmitted diseases?
Yeah, so our office number is 443-849-2765. You can reach my office staff there, and they'd be happy to give you an appointment.
Awesome. So let's go to HPV, because you mentioned human papillomavirus, and you mentioned a lot in your responses. So let's go through this. What is the human papillomavirus, and how does it affect cervical health?
Yeah. So this is a DNA virus. As I said, this is a sexually transmitted infection. But one thing that's really important is that it's not a sexually transmitted infection in the way that we generally think of things like gonorrhea, chlamydia. Actually, most people who are sexually active will have the human papillomavirus at some point in their lives. The most important thing is that many people can clear the virus. So about 70 to 80% of women will have had the HPV virus by the age of 50. However, most of the time our body takes care of it. What actually can cause cervical cancer is a persistence of that virus, meaning the virus kind of hangs out in those cells and doesn't get cleared. And that persistence of the virus over the course of about 7 to 10 years can cause changes in the cells of the cervix that then can go on to become a precancer and then a cancer.
Earlier you mentioned that there were two types of cervical cancers. So my question is, are there different groups or types of the human papillomavirus?
There are actually. So we group them into high-risk types and low-risk types. And low-risk types actually cause genital warts. So genital warts caused by HPV 6 and 11, for example, they won't go on to become a cancer. The low-risk types really only cause the genital warts. It's the high-risk types that actually can go on to form a cancer. So there's about 15 oncogenic types of HPV. And the most important thing is that about 70% of our cervical cancers are actually caused by just 2 types of HPV. And when we look at the number of types of HPV, if we look at 7 types of the HPV virus, that accounts for more than 90% of cervical cancers. And so that takes me to kind of this talk about the vaccine, because right now we have a 9-valent vaccine, which means that our vaccine covers 9 types of HPV. And so realistically, we really have the possibility of eliminating this disease and eliminating this virus.
You know, in our discussion a couple of weeks ago, you said vaccine, 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 right?
Yeah.
And so at what age, and I'll break this, At what age should children, in this, because of what we're talking about today, in particular girls, women, at what age should they look at getting the vaccine for the HPV? And just as a side note, it's also open to boys as well, correct?
It is, yes, and very important for boys too, because our way of getting rid of this virus overall is by getting everybody vaccinated. In terms of recommendations for when you should get the vaccine, we'd like to have everybody vaccinated before the age of 13. That's the ideal, and the ideal there is because we need to catch this before HPV is ever transmitted to a patient. So it's a preventive vaccine. It's not a treatment. So in order to prevent ever getting the virus, we need to have the vaccine before any sexual intercourse. So yes, the vaccine is approved up until the age of 26. However, the ideal is really to get the vaccine before the 13th birthday.
Okay. Joining us today again is Dr. Kimberly Levinson, Associate Director of Gynecologic Oncology at GBMC. I want to thank everyone again for joining us here today in our studio and at home. And please feel free to bring in your comments or your questions. I see we have Howard. Is that Howard? What's your question?
My understanding is that typically women that experience ovarian cancer, the survival rate is very low. What, if any, is the relationship between cervical cancer and ovarian cancer?
Yeah, so that's a great question. Thank you so much, Howard. So there actually is not a correlation between these two different types of cancer. These are cancers which start in two different organs in the genital tract. So the ovarian cancer obviously starting in the ovaries and cervical cancer starting in the cervix. And the etiology of these is different. So while cervical cancer is largely related to the human papillomavirus, ovarian cancer can either be sporadic or genetically related.
Dr. Levinson, let's kind of shift gears a little bit and let's go to screening, okay? Yeah. There's been some debate as far as screenings and whether cervical cancer screenings really do matter and how often they should take place. So let's put all this to rest.
Yeah.
Does cervical cancer screening matter? And if so, how often should women be screened for cervical cancer?
Yeah, so absolutely. Cervical cancer screening is critically important. And again, the reason for that is because we don't have symptoms. We don't have other ways of detecting this disease if women don't go and get examined. In terms of the frequency of screening, it varies somewhat. So it depends on what your prior screening showed. And that's because if you have the human papillomavirus, then we need to screen you more frequently in order to make sure that we're catching any changes that are occurring to the cells in the cervix. Whereas if you don't have the HPV virus and those tests are completely negative, then the screening can be extended. So one of the things that's very important is that we've been able to extend screening to 5 years for somebody who tests HPV negative and who has a negative Pap smear. And the reason for that is because the chances are so low of progressing to a high-grade cervical dysplasia or a precancer within that time frame if you have two negative tests, both an HPV negative and a Pap smear that's negative.
Again, joining us today is Dr. Kimberly Levinson, Associate Director of Gynecologic Oncology at GBMC. We have a couple of questions coming in. Samantha, what's the question?
This is an audience question. It says, because it is sexually transmitted, can a male have HPV? Can he get cancer from HPV? And can a male be a carrier of HPV? If so, for how long?
Yeah, so that's an excellent question, and I appreciate that. This is very important, and actually, yes, men can be carriers, and men can get cancers from HPV as well. And in fact, many of the male cancers associated with HPV are actually on the rise. The most common cancer is a tonsillar cancer in men, and they can get mouth cancers as well. And that is the most common place for men to actually get cancers from the HPV. And the reason for that is partially the cell type. So the cervix has specific cell types which are mostly susceptible to HPV. And on the penis, those same cell types don't exist that cause that susceptibility in the same way. In the oropharynx, we do have that susceptibility, and we are seeing a rise in the oropharyngeal cancers in men because of that reason.
I got a question from Mel on Facebook, and he asks, would you recommend a transvaginal ultrasound every year or 6 months to catch different gynecologic cancers? And then the second part is that an option for an early detection test besides a Pap smear? And I'm glad Mel brings up Pap smear because we haven't addressed that yet, but we will.
Yeah. So that's a great question. So ultrasound is basically a way for us to see the anatomy of the upper genital tract. And it's kind of two questions in there. So usually we use an ultrasound to visualize the uterus as well as to visualize the ovaries. And so I'm going to kind of move that aside for 1 second while I answer the other question that's specifically related to cervical cancer. So is the ultrasound a good test for cervical cancer? And unfortunately, it's not, because in order for an ultrasound to really pick up a cervical cancer, there has to be a large enough mass there where the cervical cancer has started to grow. The way that we pick up the cancers now is by testing for the virus itself, so before the virus even causes any changes to the cervical cells, and for looking for dysplasias at a microscopic level. That's something that an ultrasound will never pick up. To address the other question in terms of, is there any reason for women to undergo ultrasounds every 6 months or every year? So that relates a little bit more to uterine cancers or ovarian cancers. And our studies have not shown that that actually is an effective way of screening for those cancers. And part of that is because, again, we're looking for cellular changes and trying to identify cancers at early stages, which can be more difficult for ovarian cancers in particular. And unfortunately, those types of modalities just have not been shown to catch those cancers at a time when we can treat them better.
Dr. Levinson, you've provided our audience here in studio and watching us on Facebook some very valuable information. If there are women out there that want to get a checkup or a screening done, or they want to come visit you, what's the best way to do that?
Yeah, so my office number is 443-849-2765, and you can reach my office staff, and they'd be happy to give you an appointment.
We've gone over a lot of things here today. We talked about the Pap smear test, and I want to ask you about the Pap smear test because, again, there's been some debate. The debate is how often you should have it done, how accurate is it? So again, I'm asking you to kind of settle this debate. How often and how accurate is the Pap smear test? And is it the only test that can help fight off cervical cancers?
Yeah, so it's not the only test. And actually, our recommendation is for co-testing. And what co-testing means is doing the HPV test and doing a Pap smear test. Believe it or not, the Pap smear test is not a very sensitive test and only has a sensitivity of about 55%, which essentially means that it's only picking up about 55% of women who have cervical disease there. The HPV test, on the other hand, is very sensitive, and it's able to pick up those women who actually have the virus much better. And so we know that by combining those tests, by being able to pick up the HPV virus, and then also being able to look at the cells under the microscope, that our sensitivity and specificity both increase significantly. What's important about that, and I had mentioned this a little bit earlier about kind of our timing of when you should have Pap smear and HPV testing. What's important about that is that our studies have shown that if you have a positive HPV test and a positive Pap smear, that rates of high-grade dysplasia are up to about 35% over the course of 6 years, okay? If you look at women who have a positive HPV test and a negative Pap smear, that rate is only about 10%. If you flip that and look at women who have a positive Pap smear but a negative HPV test, the rates of cervical dysplasia or high-grade cervical dysplasia over a 6-year period are only about 3%. And if you look at both negative tests, so women who have HPV negative and a Pap smear negative, that incidence of high-grade cervical dysplasia over the course of 6 years is less than 1%. So that has given us the ability to really extend our screening, to know that we're picking up women well who have the virus and then have the potential to go on to have cervical dysplasia and or cancer in the future.
Excellent information. Thank you, doctor. We have a question from our audience.
Hi, how are you?
Hi.
I have a question. Now, you said that as early as 9 young women and young men can get this thing. What about people that are my age? I mean, you get the flu vaccine, and I go every year and get my, well woman thing.
Yeah.
What about, do they have anything out there for older women?
Yeah, so again, that's a great question, and this is really important, and it speaks to why the HPV vaccine is so important and why it's so important to get it early. So the answer to your question is no, there's not a vaccine for older people or for people who are actually older than the age of 26. And the reason for that is because, as I said before, this is a preventive vaccine. So it prevents people from actually ever getting the HPV virus. Once women have gotten the HPV virus, we don't have a curative vaccine. We don't have a way of curing this virus. And the virus can hang out for a very long time. And even in women that are not recently sexually active, that virus can come back. And so, again, this speaks to why screening is so important because of the fact that we don't have a treatment for HPV. So once you've had HPV, the only way for us to tell whether it's doing something bad to those cervical cells is to get that screening and make sure that we're not detecting the HPV in those cervical cells, and then we're not detecting changes in those cervical cells. So it really is critical to be able to get people before they're sexually active, before they've ever gotten the HPV virus, so that we can prevent it.
I have a quick question to ask you, and it's kind of a speed round question. Is screening, Pap smear tests, and also the HPV vaccine covered by health insurance or covered by someone's health insurance?
Yes.
Okay. Regardless of, she stopped me. I thought you would be.
Yes,
okay.
it is covered by the insurance,
Great.
up to the age of 26 for the vaccine.
Got it. I don't want to neglect a certain population base. We have talked about mostly of women who still have their cervix, but there are women that have also had their cervix removed.
Yes.
So my question to you is, women who've had their cervix removed, do they still need a Pap test, the vaccine, or even have a screening done?
Yeah, so it depends. And so the thing is if a woman has been tested positive for HPV and or has had a history of cervical dysplasia and then gets their uterus removed, they still need to be screened. And the reason for that is because even though the most common place for the HPV virus to affect is the cervix because of the type of cells there, it still can affect the vaginal cells as well. So we still need to test that area to see if there's HPV virus in the vagina that may be causing a dysplasia in the vagina. If women have never had a history of cervical dysplasia in the past and they're having their uterus out for a completely different reason, then many times we can omit that.
We have a question from our audience. Sam?
I actually have 3 people who have the same question.
Okay.
Some vaccines have shown to need a booster after 10 years or so. Has the HPV vaccine been tested long enough to show if a booster is needed?
Yeah, so right now there's not any evidence that we need a booster for the HPV vaccine. Actually, the vaccine causes extremely high titers in the blood and has been shown to be very efficacious. And so there's no evidence at this point that a booster is needed.
Okay. What should a patient expect when their doctor tells them, I think, or the tests show that you have cervical cancer? And let's be honest, how treatable is cervical cancer? We talked about that if it's caught in the early stages, that it's very treatable.
Yeah.
But how do you address your patients that,
So once a diagnosis of cervical cancer is made, there actually are a lot of steps that we have to take to figure out, 1, what the best treatment is, and 2, what the prognosis is. So when we make a diagnosis of a cervical cancer, one of the things that I like to tell my patients is that we may have multiple tests and even diagnostic procedures that we need to have done before we can determine what the definitive treatment should be. Many people, when they hear they have a cancer, the first thing is just get it out. I just want it out. I want surgery. But that's not always the right choice. And especially in cervical cancer, we know that if a cancer is advanced enough, that actually we can prevent complications sometimes by not doing surgery as the first thing. So the workup for cervical cancer is actually very critical. Most often, if not all the time, we're going to be getting a lot of different imaging to try and make sure that we can detect whether there's any microscopic spread of the disease. And then again, there may be an excisional procedure that we need to do to be able to look microscopically at how large the tumor is in order to recommend the best treatment for the patient. In terms of prognosis, yes, this is very variable, and it's part of the reason why, there's so many steps to go through once we've actually made the diagnosis. Because yes, while early cervical cancers are very treatable and even curable, if we don't catch this disease until later on, many times, unfortunately, it's not as curable.
Dr. Levinson, a lot of great information in there. Really appreciate it. We got time for one more question. Sam?
Okay, here's another audience question. It says, is an HPV positive during pregnancy ever shown to be a false positive?
So false positives are pretty low with HPV. Pregnancy does not change that at all. So we do continue to do co-testing through pregnancy, and we do recommend that women get that co-testing, and that women are screened regularly regardless of pregnancy.
Any other questions from our audience? Dr. Levinson, we're pretty much running out of time. I really want to appreciate you joining us today. Again, joining us today is Dr. Kimberly Levinson, Associate Director of Gynecologic Oncology at Greater Baltimore Medical Center. Please feel free, even though our segment is ending, please feel free to submit your questions in the comments section on our Facebook page, or you can private message us if it's a sensitive issue, and we will try to get that answered to you as soon as possible. I also want to thank again everybody here in our audience for joining us today, and for those of you on our Facebook page. I just want to give a quick shout out to a little young lady who's joining us in our studio today. It's my daughter Alexandra. It's her 11th birthday today. Happy birthday, sweetheart. All right, God bless. Join us next month on Valentine's Day. Get this. On Valentine's Day, on Wednesday, February 14th, we are going to talk about male sexual dysfunction with Dr. Ronald Tutrone, who is the chief of the Division of Urology at Greater Baltimore Medical Center. So please tune in at 12:30 on Wednesday, February 14th, which is Valentine's Day. That's it. That'll do it for now. Until the next time, here's to your health. Cheers.
Cheers.